Hi, this is Andrea Jennings. Welcome to Access for All Integrating Accessibility, where we explore the intersection of pop culture and accessibility. We'll shine a spotlight on those who are opinion leaders in the accessibility world. They are bringing change in this groundbreaking show. So join us each episode as we change the future. But Dr. Navarro, it is such a pleasure to have you here. I mean, mental health is a subject that a lot of people don't talk about. They don't want to discuss the realities of something that probably many of us want to talk about, don't know the right questions to ask. So today we're going to tackle some of those questions and hope that people can learn from this experience. And you're one of the best people to talk about this subject to. We talked, and you deal with this subject with such honesty, and you also care so much about people, and I really like that. What was fascinating was your background. Can you please tell us about your background, how you got started in this field? I think it's really important for us to hear that.
Yes, thank you for the opportunity. So I'm a native Angelino. I'm very proud of that, and also very proud son of immigrants who came searching, like many, for a better life. And I just made sure I took advantage of that opportunity my parents gave me. But it wasn't easy growing up where I grew up. I grew up in Central LA. If you know where USC is, it's around that area. And it was during a time that was very difficult. Just in the 80s, the crime rates were high, and certainly gang epidemic was taking off. The origination of a lot of gangs that you hear on the news started in that area. So it's just interesting because for me, I go back to that and think about the exposure that not only myself, but many of my friends and community members had. Right? We were at risk all the time. And I thought that there could be a different way to live. I knew people lived differently than what I did. But you had to dodge streets, cross streets to avoid being either recruited or confronted. And as a child, I thought that was normal. I learned that wasn't very quickly, but I was very fortunate to have my family be supportive, but also a group of friends that we connected and were able to navigate very difficult situations that a lot of youth in inner city areas have to deal with.
Yeah, that's so interesting because I think the profession that you're into and that you chose is all about kind of weeding out those experiences that we thought was okay. And then we later on find out, no, that wasn't the best. That experience didn't have my best interest at heart. And so that's interesting that you realize that now. But you also respect your experiences, and you understand that many people have had to go through that. So you're helping people get through those moments.
Absolutely. And, I think seeing things that children shouldn't be seeing at that age, and I'm talking about like 10, 11, 12, 13, and teenage years, like I felt like there was something that we as society, we should consider doing and changing. And so I was fortunate to have wonderful pediatricians. There's these twin African-American doctors, and this is back in the 70s and 80s, and really cared for children. And And my mother, don't know how we got referred, but it was far away. We had to do a trek and travel to get to my appointments. And that stayed with me. And there's a profession where adults can help children and give
Yeah.
like amazing advice, right?
Mm-hmm.
And so I think that's probably one part of the origin story, if you will,
Yeah.
that I hold on to. And along the way, I would say I have many angels, if you will, in my life
Mm-hmm.
that I was lucky to be able to meet and believed in me.
Mm-hmm.
When you're a child, it's hard to believe in yourself if everything else is telling you that you're not valued.
Yeah, that's interesting because I often tell people not that your environment or that your parents
Mm-hmm.
don't affect and shape your childhood, especially the first 7 years where you're so impressionable,
Yes.
but teachers, most adults,
Yes.
and it's an opportunity for adults to maybe say one kind sentence to a child, and it really will impact them for a long time.
It's amazing what children hold on to
Mm-hmm.
from people they respect,
Mm-hmm.
and if it's even sort of a few drops of just high yield, right, pearls of wisdom
Mm-hmm.
that are anchored in belief of self at that age, that's transformative. And so, but seeing a lot of the violence that I saw,
Mm-hmm.
I think my immediate thought was like, okay, maybe I can help save lives,
Yeah.
right? Um, I mean, I can quickly just go back into my memory bank
Yeah.
and I can see those traumatic events that I was exposed to.
Yeah.
And it's when people have lost their life
Mm-hmm.
and often young.
Yeah.
And I thought, what if I could have saved that person's life? So the immediate thing to me was like, be surgeon. Let's sort of figure out how to do that. And I think that was sort of the drive through high school, undergrad, and okay, I'm destined to be surgeon. I want to help this way. But once reality hits and you're on the other side, you're in training and you're seeing it happen often, gunshot wounds in
Mm-hmm.
bed one, bed three, you're like, wait, this is beyond just saving lives.
Mm-hmm.
And I thought, what happened when we would do the assessment after and I'd just be reflecting on a 21-year-old coming in, and I'm like, where, where could we have prevented this?
Mm-hmm.
And I went back to my childhood and I thought about where along the path of someone could someone intervene
Yeah.
and make a path, right, where we can prevent this outcome.
Yeah.
And so as you get more exposed to different fields in medicine, psychiatry
Mm-hmm.
sort of came up as an idea. And I'm like, wait a minute. Okay, psychiatry. So let's help people how to manage stress, trauma, learning differences that can change the trajectory of your life. And it it just started to feel more where my heart was. That's what was pulling at me. As much as I wanted to be in the OR, and it's just helping youth really called to me. Um, and particularly one night in the ER, it was late and I was ready to go home. It was a long day. There was this adolescent boy who was coming in who had thoughts of not wanting to live anymore. And it unfortunately it wasn't because of things that were happening outside of his home. It was things that were happening inside of his home that triggered depression, that triggered trauma, that triggered the the loss of wanting to pursue living. And I had asked a simple question, what would help? And he said, don't let me go back home.
Mm-hmm.
I think that was interesting because most people don't want to stay in the hospital. But this adolescent young man was saying, no, if you keep me here, you will save my life.
Mm-hmm.
And so to make a decision like that would change the way someone will make a dramatic impact on whether he was alive or not was as easy as holding someone in the hospital. And that night, I was like switching out of surgery, moving into psychiatry. And I never looked back.
You mentioned, thank you for that story.
Yes.
It's powerful. The origins of why people make life-changing decisions about their career pathway.
Yes.
And the fact that you have helped people. And you've crossed paths with people. You've crossed paths with people you've made a difference in their life. You mentioned a couple of things. You mentioned loss, and you mentioned traumatic experiences. That brings us to a lot of loss in the community that experienced wildfires and trauma. And I want to talk about that and even how it affects children and how maybe people can help prevent some of those experiences if it's maybe explain to them what happened. But let's talk about loss.
Yes.
People lost a lot in the wildfires. Altadena has a very high rate of Black generational wealth that in a few seconds was just wiped away. Not that everything is about wealth, but when people work so hard, maybe 3 times as hard to build up a place, a roof over their heads that gives them security, that's a lot. It's a lot of loss.
Yes.
Memories, things that meant a lot to them. What kind of advice do you have for people that are experiencing loss?
Yes. That has been a very traumatic communal experience for the city of Altadena and the city of Pasadena, and especially when lives were actually also lost. That really hit our community really hard. And the moment that happened, it's so much confusion, which is part of trauma, and that's how it happens. It's like almost like your brain feels scrambled. And trauma and loss feels that way. And so we go through a lot of emotions when that happens. But to zoom out a little bit and to think about some important topics that I've been talking to our community members is this idea of we live on a spectrum of survivorship. Right? Those that lost their lives, those that lost their homes, those that didn't lose their homes but lost their neighborhood. They couldn't go back. I still know people who are unable, and their house is standing, unable to go back yet. And those who were farther away enough where the community is intact, but there's a lot of guilt. What people may label as survivors' guilt. And that's also a type of loss, right? And as we go further out, sometimes it feels like, if you go far down or far out enough, like people have moved on.
Yeah.
Right. And the hard part of this wasn't just losing the place where they celebrated holidays, whether it's Christmas or other holidays, New Year's, but it's just birthdays and celebrations. And even that weekend, January 4th, I was celebrating my mother's 85th birthday. And as part of the community, I was along the line of fire, if you will. But I was so grateful for that birthday that I was able to celebrate for my. And so, we think about, yes, the equity in a property, right? And for some, that's all they had,
Yeah.
and it's gone. But for others who may be more lucky and had resources, like it's memories. I almost sometimes feel that houses act as a entity
Mm.
that sort of is embracing the family, if you will.
Mm.
And it's almost like losing someone in the family. Yeah, before I left, I remember even touching the wall of my house and thanking the house.
Mm.
Didn't know if I would come back to my house.
Yeah.
And but that's when we think about trauma and we think about that experience that just ruminates, how did that happen? Why did that happen to me? Why am I, what did I do? Am I a bad person? And all of those are the stories that we tell ourselves. That's the narrative inside our mind.
Mm.
It wasn't anything that we did wrong. It's just the wind turned a certain way. Certain things weren't there.
Mm.
There's a lot of sort of scenarios that brought to this point of loss.
Yeah.
And if we're not dealing with loss
Mm.
and we can't move forward,
Yeah.
and we need to find a way to move forward. But when you're not sleeping, you're feeling down, you felt like life isn't being fair to you.
Mm-hmm.
Some people turn to bad habits, um, and some people turn to alcohol or drugs and substances
Mm-hmm.
as a way to cope. And I'm talking not just about the adult population, like even the adolescent population started increasing use. With the young population, we were seeing fear that if they had a home or they were displaced,
Mm-hmm.
like fearing that any shelter they had would also burn down,
Yeah.
which you can probably connect the dots of why a child would think that.
Yeah. Well, you've said a lot, and I'm going to go back a little bit. What I hear you saying is that there's several types of loss.
Mm-hmm.
There's loss of life.
Mm-hmm.
There's loss of, like you said, entity, that
Mm-hmm.
support
Mm-hmm.
that really was somewhat a false sense of security. But all in all, it's grief.
Mm-hmm.
And you talked a little bit about children, and I want to say, first of all, some people are going to feel anxious.
Mm-hmm.
And how do people process these feelings
Mm-hmm.
of grief, of anxiety, of loss? What are some tools that you can give people in general of what they can do to help cope so that they don't turn to outside sources that may not be healthy for them? And then also, I don't want to call it the wrong name, but what do we call people who may depend on outside sources?
Yes. I think we're moving away from words like addiction or someone who's an addict or it just the stigma that comes along with it isn't helpful,
Yeah.
right? And so as healers, we're trying to create access
Mm-hmm.
to care,
Mm-hmm.
not create barriers to care. And so more appropriate to say substance use disorder,
Okay.
right? Or even have problems with the word disorder, but that's currently what we're using, right?
Mm-hmm.
And it's more of something outside of you, right?
Mm-hmm.
Not something that you are, right? And I think moving away from just a good general rule is to move away from labeling someone something like but that feels descriptive of their character or their personality
Yeah.
versus no, this is a disease that someone has. And like anything else, if you have high blood pressure, elevated cholesterol, all those different things, right, that you would treat it similarly.
Mm-hmm.
Um, so I would think that if you're feeling anxious or feeling uncomfortable or panic attacks where people feel like heart rate's going up, sweaty, loss of breath, and really uncomfortable,
Mm-hmm.
um, I would say talk to someone.
Mm-hmm.
The worst thing you can do is isolate. And right now there's a lot of shame that people have
Yeah.
because like why did I lose it, right?
Mhm.
And feeling an embarrassment of having to talk about what happened.
Mhm.
And and so people tend to, just human behavior, tend to isolate.
Mhm.
I would say do the opposite. Lean into connecting with others. Lean into community. If there's a house of worship, lean into that community.
Mhm.
If there's family that's really close by, lean into that support. Friends have been very helpful for many also.
Mhm.
And finding what your community is, because I think if you can do that,
Mhm.
then you really are treating yourself. And I do mean it in the way of medicine. I believe that community is medicine, and this is probably the first type of medicine that people should be ingesting is
Mhm.
community, right? Really being able to connect.
Yeah. I love what you're saying. Two things, and you mentioned loss of life,
Mm-hmm.
which is a priority.
Mm-hmm.
And then there's probably many people that were in positions like
Mm-hmm.
firefighters or
Mm-hmm.
city officials that feel this sense of responsibility for the loss of life because the other things can be replaced.
Yes.
And we did touch a little bit
Mm-hmm.
on the
Mm-hmm.
survivors, remorse and guilt.
Mm-hmm.
What do you say for people that it didn't directly affect them, but it did because they just wish they could have done more? They feel a little guilty for having their home, or they didn't lose,
Mm-hmm.
what everyone else lost. So they feel strange, like they want to help. And then the second thing is you mentioned that people shouldn't isolate. And I'm really happy to hear you say that. But many people don't know how to reach out to their friends and family once they have started
Mm-hmm.
isolating.
Yes.
So if you can give the supporters some
Mm-hmm.
advice about how they can help.
Yes. And I think the best way to answer that is really talking to the supporter,
Mm.
right? The person who didn't lose and has more survivor's guilt and remorse and feeling like, what do I do? How do I help?
Yeah.
And initially, when it all happened, there was an overwhelming energy of people supporting and giving. And some people feel like, well, like they don't need me. I'm too much. Like I got turned away from volunteering, right? And then I said to them like, oh, no, this is a good opportunity for you to fill up your cup because it's about
That's good.
not currently what's happening, it's about what's coming.
Mm-hmm.
And what's coming is down several weeks to months where people are really going to feel it,
Yeah.
and you will be ready
Yeah.
to be there.
This is not a quick fix. This is a rebuild. It's going to be around for years.
That's right.
Yeah.
That's right. And so I would say to find those opportunities. You can be more strategic about it and even more aligned with the groups you want to participate because a lot of support is going to be required.
Mm-hmm.
Um, and the other thing I would say is like a quick text. I mean,
Mm-hmm.
some of us, I know I did. I think I had like like over 200 texts I couldn't get through,
Yes.
and I appreciated all the love, really, just to call it what it is,
Mm-hmm.
and the care.
Mm-hmm.
I didn't have the capacity to at that moment, and I did eventually catch up,
Yeah.
right? But I would say reach out to people,
Mm-hmm.
and if you're thinking about them, and you're saying, I wonder how so and so is doing right now,
Mm-hmm.
like call them,
Mm-hmm.
find out,
Yeah.
go take them out to lunch, um, breakfast, coffee, go for a walk. I mean, there's a beautiful park here.
Yeah.
A place like this, just go for a walk,
Yeah.
catch up.
Yeah. I'm glad you mentioned that because I was one of those people that received the text,
Mm-hmm.
but I found myself a little bit overwhelmed to answer each one. I'm so happy you brought that up.
Mm-hmm.
It was really welcoming.
Mm-hmm.
Just sometimes I didn't have the energy to to answer each one, and I went back and realized I missed them. So, but I'm so happy you brought that up because people may not feel that their efforts were appreciated. And then you mentioned something about filling up the cup. That is so good. Some people don't know how.
Yes.
So when you say
Yes.
filling up the cup,
Yes.
what do you mean by that?
Yeah. I mean, get enough sleep, at least 8 hours a night.
Okay.
Have a routine. I don't mind sharing mine.
Please.
We're nearby where I like to come and take a walk around the Rose Bowl and do that sometimes in community and in friendship. I do that sometimes alone, listening to a podcast or just being with my own thoughts, right? But usually it starts at home with a shot of espresso. Personally, it's the way I do it. And that's all I need. And then get into working out. We undermine the need for moving our body. We think it's something that it's for aesthetics. We think of something it's a life alternative option. It's a lifestyle, life choice. I'm here to tell you that it's a hygiene. That we all need it.
Yeah.
It's something that the brain needs. And if we commit to that, you're already ahead. You're definitely filling up your cup.
Yeah.
Right? Making sure you're getting nutritious meals, regular meals too, getting a protein, right? And not to get too into detail about these things, but really having a routine for yourself that anchors you, because that's what makes life predictable. Right? When life is unpredictable, your routine, you know what you got going next, and then when uncertainty comes up, you know how to manage it, or at least attempt to. Maybe you don't have the capacity to do it, ask for help. As a man of color, and a lot of people in my community men specifically don't like asking for help. I'm trying to flip the script with them, like it's okay. It's okay to talk about your feelings.
Yeah.
It's okay to talk about feeling upset, feeling sad, which is a really hard one for them.
Yeah.
This is the time to lean into and learn how to do that.
Yeah.
If you have children, especially if you have a son, you're mirroring behavior. You're teaching, honestly, life skills of how to cope with stress. Because when we don't talk about it, that's when we get into trouble.
I love all what you're saying, and I'm smiling not because this is a subject that is light, but I'm smiling because we don't talk about this enough, and I'm like, we're talking about this, like this is good.
Yes.
You said something because sometimes some things are abstract for me, and I'm thinking it could be abstract for someone else, but you said we need to have routine, right? And then I go, well, what if something throws us off our routine?
Yes.
Now, how do we go back to that? Like, for instance, people with the fires, they had to live in shelters. How can they get that sense of routine when their routine has been thrown off?
Yes.
So,
That's a great question. Routine's gonna look messy, and it's okay if it is, right? Maybe you're not doing your 3 mile run anymore. You're in this sort of situation, unfortunately, right? Or go for a walk, change it up, adapt it, right? Currently, I tore my calf muscle, and I'm not doing what I'm usually do, but I'm adapting to it. It's what my brain needs. And when you do this long enough, you start realizing this is what everyone's brain needs. You don't have to be too rigid with it. Be flexible. Give yourself grace. If there's going to be a time in your life where you're going to have to give yourself grace with a routine or anything, is right now.
got it. So what I hear you saying is there's routine, but broaden your definition to what that routine could be. It
That's right.
may not be this 3 mile walk. It could just be circling your environment, but you're still kind of adapting to, that. This is really good, by the way. Children,
Yes.
they are a little bit different than the adult mind. They have different minds.
Yes.
brilliant as they are,
Mhm.
things are probably really scary for them.
Yeah.
What advice do you have for teachers,
Yeah.
parents,
Mhm.
adults
Mhm.
that are around children?
Mhm.
How can they explain to them?
Mhm.
Because you don't want to like lie to them. They know that there was a fire. They know
Yes.
that there was a disaster. They know,
Mhm.
unfortunately, that lives were lost.
Mhm.
How do we explain to them
Mhm.
what happened? How do we answer their questions? Because some
Mhm.
of them were very confused or they have their own anxiety. So, how do
Right.
we deal with that?
I think the best way is to allow children to share their story about it.
Mm-hmm.
There's many different ways to do that, but sometimes even just coloring
Mm-hmm.
through it, or something we do in play therapy is sort of play, and then you'll see it, they'll act it out, right?
Mm-hmm.
And then you could be curious. This is probably the best way for parenting is to be curious with your children.
Got you.
Right?
No, don't pretend like you have all the answers or
That's
you
right.
know it all. Got it.
Yeah. What do you think that means? What's going on here?
Mm-hmm.
Oh, why do you think that?
Yeah.
Right. And I think that is important. It's hard to have patience when you're in a bubble with your family,
Mm-hmm.
right? Like you're okay, that's okay. What do you,
Right.
and that doesn't work.
Right. And they may not trust you if everything
Right.
isn't okay.
Right. That's right.
Yeah.
That's right.
Mm-hmm.
And so with children, you you have to be first. You have to make sure you're doing this in a very developmentally appropriate way,
Right.
right? Then you want to make sure you're not re-traumatizing. That's a little hard to do. But
Mm-hmm.
part of trauma and healing from trauma is telling the story, talking through the story.
Yeah. I love storytelling, by the way.
Yes,
So
yes,
when you said that, I was like, oh, that's really good.
yes.
And the different ways, because me being a filmmaker and um, the different ways that they can tell. So we're listening to them. They're expressing themselves through
That's right.
storytelling.
That's right. And I like to share like that. You're the author of your story,
Mm-hmm.
right? We can sometimes change stories in a way that can be reframed in such a way that's powerful and healing versus debilitating and isolating,
Yeah.
right? Empowering your narrative.
I love that. Any advice for people that have been displaced? I know we touched on
Mm-hmm.
certain things,
Mm-hmm.
but people that are still displaced,
Yes.
that's got to feel strange because they're not in their environment. There are people that were affected that are aging,
Mm-hmm. Mm-hmm.
and the aging population, not all, but there are some who do better when they're in their environment, like you said, with a routine.
Mm-hmm.
If they're taken out of their environment, sometimes certain things can get worse.
Mm-hmm.
They may know how to go to the kitchen a particular way, right? And you just, you're changing up their environment. But so, what do you have advice for those who have been displaced?
I think for that community, I really believe that trying to identify um, an opportunity to one understand that this is a long journey, it's a long road ahead, right? And with a long journey like this, you're gonna know that it's like really taking one step at a time, right? It's gonna be frustrating, right? I've heard statements such as, I have another full-time job to do,
Mm,
right? And those who are hearing this, they know what I'm talking about.
I know what you're talking about now.
Yeah,
Yeah.
right. You have to live the life you were living, going to work, taking your children to school, or if you
Hmm.
have children or not. And then
Yeah.
you got to get on the phone
Hmm.
and you got to call insurance
Hmm.
and you got to, and that is, I think, a big, difficult part of the displacement, right?
Yeah.
That you don't have what you had yet. Now you have this burden,
Hmm.
and that in itself uh, just it weighs heavy on people.
Yeah.
Um, take your time with it.
Mhm.
It's easy to say, be patient, but you're not going to have days sometimes that feel like you're right on top of everything. It's not going to happen that way. But give yourself some grace in those moments.
Mhm.
And I would say what I'm finding is people who have lost finding community
Mhm.
together. And we know that when you bring people together, there's more of a voice that's heard.
Yeah.
And sometimes you have to do that.
Mm.
Um, but again, not to isolate, not to isolate.
Yeah.
If you have family, this is a time to lean in and say, can you help me at this moment? When I got displaced, I did that. And that was really hard for me to do because usually not only does the community come seeking for my help, my family does that with me too.
Mhm.
But here I was asking with my son, my wife, our dog, and our 3 parakeets.
Mhm.
Do you have space for us?
Yeah.
And sorry that I'm bringing this all along, right? But I would say that I'm super grateful for them to say yes. And
Yeah.
I think we need to lean into that in a time where we really need it.
I agree. It does. It's not a happy thing and a happy situation,
Mm-hmm.
but it does challenge us to grow beyond doing things ourselves and allowing that community that you speak of. And also, what about just the power of nature? Like we're outside right now.
Yes. Yes.
You know what I mean?
Yes, absolutely.
Sometimes, again, not glamorizing trauma or any type of disaster, but I know that sometimes just being still
Mm-hmm. Mm-hmm.
is difficult,
It is.
but it can be healing while you process your thoughts. So, what role does
Definitely.
like nature play in coping?
Yes. As I've grown through the years, I spend more time outside than I do inside now, and it is healing.
Mm-hmm.
Um, and there's something about hearing the birds,
Mm-hmm.
hearing the rustling of the leaves. In fact, I do this walking meditation,
Mm-hmm.
and sometimes if I take someone along and I'm trying to teach them,
Mm-hmm.
I want you to focus your attention on that tree and see if you can hear the leaves rustling,
Mm-hmm.
right? I want you to identify, so just moving through, refocusing your attention to the present moment, right? Because what you'll realize when you are in the present moment and when you're doing it in nature, and there's
Mm-hmm.
nothing like nature to allow you to do that effectively,
Yeah.
right? You realize that you're safe
Mm-hmm.
despite trauma,
Mm-hmm.
and it lives in our memory bank. It's here, you carry it everywhere. But when you're in that moment, you can start training your brain that you're safe.
Did you say? Is that almost like grounding?
Yes, that's exactly what it is.
Okay.
That's
I'm
exactly
like,
what
I
it
hope
is.
I'm using that
Yes,
correctly.
you are.
But like when you
Yeah.
said like focusing on the bird or
Yeah.
that little tree rustling, it is very grounding.
It is very grounding.
Yeah, I love that. We talked about access requirements. We were talking about, people
Yes.
that are aging,
Yes.
and why I don't, and many people don't prefer accommodations because it sounds so much like it's something that you can do, you may not, but access requirements, and you mentioned it earlier, access to healthcare. It's a requirement. It's something that it should be the baseline, like you said, in the medical profession, everywhere.
Yes.
So, how do you use the word access when it comes to your clients, advocating for them?
Yes. And it's interesting because in the industry, if you will, you have letters of accommodations,
Mm,
and it's all framed this way,
mm,
right?
mm,
and it's like optional. It's kind of like the whole thing with what I said with movement and feeling like it's a lifestyle, right?
Yeah.
No, it's a hygiene, and if you can see the parallel process of what I'm trying to share
Yeah.
is that no, this is a requirement. If you got tested and identified that there's a need, that's a requirement, right?
Yeah.
It it's interesting. I mean, and I'm so grateful that time has passed and institutions have evolved.
Mm-hmm.
But there has been historically where I was on phone calls with schools and trying to get requirements for access
Yeah.
to needs that they have for exams, for example, right? And I'm talking about children specifically,
Right.
right? And and then I would get responses like, well, you know, every teacher is a little different, and if they want to implement them, I go, no, you don't understand. This isn't an option.
Right.
This is what they need. This is a
In order to
requirement,
be successful.
right?
Yeah.
Right, and to be closing the gap of the
Mm.
need that they have, right? As a mental health provider, I provide letters and phone calls to try to make sure that children get and receive the requirements that they deserve,
Mm-hmm.
right? When I even touched on people who have physical disabilities
Yeah.
and the requirements that they also have, right? And I think just I wonder why we have such a problem with these things.
I was thinking the same thing.
But I think I've understood. I've been reflecting on the idea, and I think we're lacking empathy
Mm.
as a society.
Mm-hmm.
Like we know we're really good at othering.
Mm-hmm.
We're really good at identifying the difference, right? Um, but we have a hard time identifying the similarities,
Mm.
the humanity that we have in each other.
Yeah.
If we can see that, then it makes a lot of sense that you do have this requirement.
It does. And I was thinking about that recently. And I think we have so much individualism that we forget about collectivism. I don't know if I'm saying that right, but collectivism, yeah. Where we forget about community. We
Yes.
forget about humanistic traits. But you know, from the beginning of our conversation, when you were talking about your history and how you came into this, I mean, I'm looking at, you know, where you began, and I'm just really touched by the fact that the work that you're doing, you're making a huge difference. What would you like to tell people that may have experienced life the way you experienced it, and they may not be able to go into the same field that you went into, but just, you know, how they can maybe reach and maybe what is it? Reach one, teach one kind of thing. Yeah.
Yes. Um, in medical school, it's interesting you say that phrasing, but in medical school, we have this teach one, or actually see one, do one, teach one,
Got you.
right?
Yeah.
And I have a really good friend of mine, and we've taken walks here, and he's this 6'3", like two, I don't want to call it out, but 230, like big guy, and uh, bald hair, right? Bald head, big black man, right? And we have these conversations of how do we create a future for our youth,
Yes.
and we're working on it. But I think if I can share a message related to that, we really need to start at a very young age, right? And those who are already advanced, whether you're a professional, whether you're a pro athlete, whether to be able to come back to community and make that accessible. Don't be untouchable, be accessible.
Right.
right? And when you're talking to youth that way, um, they can start seeing themselves in you.
Yes.
And when they can do that, then maybe there is a path for me.
Yeah. I love that because full circle,
Yeah.
you mentioned like the twin doctors, you
Mhm.
mentioned certain people that said things to you.
Mhm.
And again, not everybody has the capacity to help others.
Mhm.
People are just
Mhm.
making it day by
Mhm.
day. But just like we talked about, one sentence, one kind word to a youth. And I agree. I agree. Thank you so much for sharing your story with us. Um, how can people find out more information about you? Are there any programs currently that you're working on?
Yes, I'm very proud to be the founder and CEO of Reswell Health here in Pasadena. And we are an integrative psychiatric practice. So not just medication, therapy, but we have an actual gym. I like to say that we're a clinic with a gym, right?
Okay.
Um, and because we're teaching people how to move.
Hmm.
And so we prescribe it, right? How to move, and that might mean strength and conditioning, it may mean mindfulness and meditation, pediatric yoga, right? And then nutrition and thinking about incorporating that.
So literally moving.
Oh yes,
This is
oh
good.
yes, oh
Hmm.
yes. It all started in my office
Hmm.
having these conversations with teens, and they're like, Dr. Navarro, I don't know how to do a push-up. I'm like, I'm going to teach you how to do it,
Right.
and I'm going to teach you how to do air squat. And I'm going to teach you how to do this. You don't need anything. You don't need a gym. You can do this at home. But what you do need is a prescription. So I started writing these things on a prescription pad. I go, you're taking the medicine that I'm giving you. Do I need to write it on I go, you know what? As I was saying that out loud, I go, you do need a prescription for movement, right? And an infinite amount of refills for this. Here you go, right?
Right.
And so it was born out of this idea that the brain isn't just a neurotransmitter to a receptor.
Mm.
It's not just a pill that does that.
Hmm.
The brain is so complicated that it's so many different ways. And so we meet people where they are
Hmm.
and we take them on their journey. And I think of myself more as a guide
Hmm.
than anything else because I think it is a journey. It's a journey of people's own what I call their mountain,
Hmm.
right? And I've guided many people,
Hmm.
so it's how we sort of do it in our clinic.
I love that.
Yeah.
I love that. You're literally teaching people how to move.
Yeah.
And that's something that is accessible
Mhm.
to many of us.
Yes.
Yeah.
Yes. The other thing that I've been trying to solve is, and this is a deeper conversation and
Mhm.
probably another conversation to have, but it's just the inability to create access to mental health
Mhm.
services.
Mhm.
And as someone that's been around for a while, I know what that also means.
Mhm.
And as a provider, it's been really difficult to then think about how do we incorporate insurance and healthcare
Yeah.
into practices. So currently in our practice, we're trying to figure out and get creative
Mhm.
with creating access to care.
Mhm.
And that requires a village. Like, and I don't just mean Reswell as a clinic, I mean collaborations with communities. That's really what I'm talking about.
Mhm.
And for us not to close ourselves up in silo, but to create access to what other strengths that people may have
Mhm.
that we can come and bring together to
Mhm.
serve our community best.
That's powerful. There's so much support when we are that collective
Yes,
that we talked about.
that's right.
For people who may not be able to move in the same way that others, what would you suggest for them if they were to come to your space?
Yeah, no, we are very adaptable.
Okay.
So we've seen people with limited ability to move
Mhm.
and grow from that experience.
Mhm.
And when I heard we had someone coming in who had a history of polio,
Mhm.
I'm like, okay, how is this going to work? And we just got together and got creative. And I think that's really what a platform does is we adapt and we look at solutions when everyone else is like, I'm sorry, I can't help you. I that's when I sort of feel like I feel challenged to let me find out how I can help you.
Yeah. Well said. I mean, earlier you said you meet people where they're at, and that proves that you do. So
Yes.
thank you so much.
Well,
So the first thing that I want you to do is close your eyes. Okay. And I want you to have your feet planted on the ground. And if you can, your hands on your lap. Okay. And now, through your nose, I want you to take a deep breath and then exhale slower through your mouth. Very good. Let's do that again. In through your nose, out through your mouth. And then one more time. Very good. Now you can open your eyes, and I want you to hold your hand up. Most of us have 5 fingers, some of us don't, but that's okay. This is a symbolic gesture. It's important to realize that all human beings are built with the DNA for joy. You can put your hands down. And the reason I use your hand is because joy is within our reach, but many of us have forgotten how to access joy. And the mind-body connection that you just demonstrated just now by taking 3 breaths, being grounded, being present, and being intentional allowed you to access joy for a couple of seconds. But we forget about that. Many of us are healthcare professionals in here, and I can't tell my heart to stop beating, right? I can't tell other parts of my body to stop working. I can't tell my liver to stop processing, but I can hold my breath. Why? Because we were made with this powerful tool to control our stress. Yes, it helps with survival, right? If we smell something that's a toxic gas, we have to hold our breath. If we're plunged into water, we have to hold our breath. But also, our breath allows us to calm the fight or flight and to give us a sense of control, even in the midst of chaos. So that very symbolic, powerful gesture is to remind you that the mind-body connection is real, okay? And many of us, over the past couple of years, since 2020, have felt as if we've been in chaos. Yes, things on the outside look like they're normal. We're back to usual. We're open for business. But many of us have not processed trauma. First, the pandemic, we're not safe. Then we are safe. Then there's uprisings. Then there's police brutality. Then there's massive, chaos. There's war. There's climate change. It is like a tidal wave, wave after wave. We can't catch our breaths, right? But if we don't process our trauma, then we cannot ride the wave, right? There's a difference between feeling like we're drowning and riding that wave. So we have to develop tools for this. And it's important for us as healthcare professionals to do this because, we're the healers, but many of us are unhealed. And there's a lot of literature coming out saying that healthcare professionals who are not full of joy, who are depressed, who are burnt out, who are anxious, who are in fight or flight, who are overwhelmed, they make mistakes, important mistakes that cost lives and they cost money. So we need to invest in joy again, not just to save $1, but to save lives. And when we are joyful, right, when we make these decisions for our patients and our communities, when we are joyful, guess what? Joy is contagious. So I asked a question earlier about clinical research. I'm a principal investigator of my own lab in Midtown, very close to here, and I enroll patients all the time. So during the pandemic, we stayed open because we had FDA-regulated studies that had to keep going. You got to continue research, even when people are afraid to leave their homes. We find a way, right? And patient after patient I saw who came in, a lot of times they wouldn't meet criteria for depression, but they check all the boxes, but instead of breaking down, they were over-functioning. They were showing up, so they were wearing this mask of productivity. And I started looking into something called high-functioning depression, which, as a board certified psychiatrists trained at Columbia, fancy institutions, they said that's not a real thing, you know? As long as you're functioning and you're showing up, you're good to go. So imagine going to your doctor and saying, you know, I don't feel joy anymore. I'm feeling tired. I can't concentrate, I can't sleep. Food doesn't taste as good. And the doctor's like, well, are you functioning? Yep. All right, I'll see you when you break down. This is a problem. So there's a renaissance happening in medical health today where you see a lot of longevity science. There's a menopause boom. Dr. Alita and I were talking about that. We're really thinking about preventing physical breakdowns, but we're not there with mental health breakdowns. We wait for people to be in crisis to break down before we do anything about it. This is a broken model. So I want to teach everyone in here how to access joy. And guess what? It is free. So you're in for a treat. So you know those 5 things I talked about, your fingers. Think about this. The first part, many of us who are busy, overproductive, thinking about other people, we don't validate when things are going wrong. Someone asks you, how's it going? You know, like today, many of us said, I'm fine, you? Oh, great, yeah. Very rarely will you hear someone say, I am tired. Like, I'm burnt out. I am depressed. You don't hear that. So you don't have to say it out loud, but I want you to, after I count to 3, either say it, whisper it, or think it. I'm gonna ask you, how do you feel? 1, 2, 3, how do you feel? I heard a couple of things, tired, great, stressed, right? You can validate both positive and negative emotions. It doesn't always have to be negative, right? And the reason that you want to validate how you feel is because it's evidence-based. There's something called affect labeling. Human beings do not like uncertainty. We need to know what's going on. So when you don't know how you feel, you're stressed. That's why people go to therapy, so that you can talk to people so that they can identify how they feel so they are less stressed. Number 2 is venting, all right? So you just all vented. You let out the steam. You talked about what you were feeling inside. People are not comfortable talking all the time. Some people like to pray. Some people like to cry. Crying recently has been like a really good one for me. Like if I'm stressed, I cry a little bit, I feel better, right? There's nothing wrong with expressing these things. Some of my artists that I treat like to sing or paint. Just express it in a way that feels authentic to you, but get it out. The third is values. Now, values are things that are priceless, that don't have price tags, but we often chase the things with the price tags. But think about the things that mean the most to you in life, like your faith, the causes you believe in, like your community. That's why we're all here. Our families. These are where we should be pouring a little investment daily. It doesn't have to be a lot, but when you pour into your values, the priceless things, not the price tags, the research shows us that that makes you happier. And the fourth is vitals. We talked heavily about vitals today, right? We talked about getting good sleep, getting good movement, eating foods that are not processed. But the other vital that we haven't really discussed is our relationship with technology, and I'm guilty of this too, right? But we have to understand the ways that not being able to break off from work and technology impacts us. And the number 1 predictor of longevity is our relationships. So you can eat all the kale you want, but if you're with someone toxic, it's gonna drain your life source. So let's think about that too. And the 5th V is vision. How do we plan our joys? How do we celebrate our wins? In my lab, you know, whenever we pass a training, Danielle knows this, like when you do clinical research, you do training after training, it just becomes numb to you. We celebrate each training, we print it, we put it in a binder, and we say, this is what we did, right? Celebrate the small wins. So if you got your kid to school on time like I did this morning, I celebrate that because it's hard. Sometimes it's hard, right? Plan joy. The way that we plan out our schedules, make time for joy.
I hope you learned something today watching Access for All Integrating Accessibility, where we dive deep into the subject of accessibility beyond and above compliance.